Good evening, dear friends, and welcome to my YouTube channel, Jaidev Surgical. This is Dr. Gautam Jaide, and I am here today with one more new topic for discussion. Who is supposed to treat mucormycosis? So, friends, mucormycosis is an aggressive fungal disease which typically happens when a person's immune system starts collapsing. In the present day pandemic times, due to excessive use of steroids and in diabetic patients with prolonged hospital stay, this disease has suddenly gained an upper hand and a lot number of cases have sporadically been reported. This disease is so aggressive that it eats away everything that comes in its way. It typically starts in the nose and starts spreading into the sinus. It involves the upper jaw, upper teeth, and in very severe cases, it can involve the eyeball, the blood channels, and even the brain. If not addressed on time and diagnosed well, this disease can claim a person's life. So, having said this disease is not a one man's job. It requires a dedicated team effort, and this team typically consists of an ophthalmologist, an ENT surgeon, maxillofacial surgeon, a neurosurgeon, a reconstructive surgeon, a dentist, a physician, pathologist, and a prosthodontist. Each individual treats one particular dimension of the disease. When the disease is limited to the nose and the sinuses, it's primarily the ENT surgeon who comes into the picture. When the same disease involves the upper jaw and the teeth, it's the dentist, the maxillofacial surgeon, who help in removal of the disease by removing the upper jaw. When the same disease extends into the eyeball and involves the eyeball, causing loss of vision, then it becomes very important for removal of eyeball so that the disease doesn't enter into the brain and prove fatal. During this time, an ophthalmologist or an ophthalmic surgeon, an oculoplastic surgeon we call, is a person who is the key. If the disease has been found to invade the base of the brain, then a neurosurgeon also will have a role to play. For the overall management of the patient, in terms of drug delivery, in terms of monitoring his renal functions, in terms of monitoring his electrolyte functions, a well-qualified physician, a competent endocrinologist are a must. And for an apt reporting of the disease, the pathologist role is absolutely important. The maxillofacial surgeon, the reconstructive surgeon, and a prosthodontist have an indispensable role in the management of the disease during the later part of its course, that is, when a person completely recovers of this disease and is ready for rehabilitation of the lost jaw and the teeth. So, dear friends, in short, mucormycosis is a complex disease which involves multiple organs and is satisfactorily and very well treated only by the teamwork. Thank you all for your patient listening. I'll see you again in the next video. This is Dr. Gautam Jaide signing off. Until we meet again, bye, good night.